Hello, AIM Board of Directors. I'm excited to present our end of the year report for 2022, and it was completely, utterly extraordinary. So this is the impact report. This is part one of your reports for the board meeting next week, and I'll do a fundraising report, financial report, and then we'll look at the proposed budget for 2023. So our mission, AIM Youth Mental Health, is bridging the gap between research and access to care for youth struggling with their mental health by finding, funding, and implementing evidence-based treatments, empowering youth to discover their own mental health solutions, and training caring adults to create a safe holding place for youth in crisis. At the board meeting, I want us to have a conversation about the last sentence, the last part of our mission statement, because we've had some feedback on that and given it some thought. And so here's just an idea, but we can talk about it. Is the last part to train caring adults to create communities where children can grow into healthy, happy adults. We may want to wordsmith that a little bit, but put that in your thinking and bring your questions and suggestions to the meeting. Okay, so remember, we set strategic goals. We did these in 2021. We reviewed them at our annual meeting in October, and we set them forth for this year, 2023. So let's take a look at them just to review. Goal one, to improve the quality, consistency, and accessibility of evidence-based treatments that address youth mental health challenges. And we do that by finding and funding research protocols that bridge the gap between what we know and what we do. Goal number two, to develop a talented, unified team of boards. We have our scientific advisory board, our fiduciary board, and our youth advisory board, and our staff, and then key volunteers with both individual and collective clarity of purpose, goals, and responsibilities. Goal number three, to build a safe, healthy, supportive, to build healthy, safe, supportive communities by raising the general level of knowledge, youth mental health knowledge, and raising the skills among stakeholders. That's another one of our goals. And you can think about our programs and how we're doing that. Goal number four is for AIM to emerge as a trusted and respected, relevant thought leader in the local and national youth mental health communities. And also, number five, we always want to build and fund a sustainable organization. We want to build sustainability into our funding models. Okay, so let's look what we did in 2022. This is our impact. This is just a very broad brush. We did so much more than this. But in 2022, we invested. We bridged the gap between science and access to scientifically based youth mental health treatments. We awarded 6 grants in 2022, totaling $180,000. We gave implementation and equity grants to Dr. Brianna Last. And I kind of wrote down the question about what these researchers are looking at. So here's Dr. Last's implementation and equity grant idea. How can we remove the structural barriers that underserved youth face in accessing evidence-based treatment? Dr. Jarrell Enzel from Cornell, it all rhymes, is looking at how he's doing his research in California about how we can heal the underlying mental health challenges that drive inner city youth to violent reactions. And then Dr. Evelyn Cho is looking at the implementation of MATCH, and MATCH is a personalized intervention tool for to assess for anxiety, depression, conduct disorder, trauma, and mitigate that. And that using this tool may mitigate some of those disparities between racial and income disparities in accessing care. It's an assessment tool that will help mitigate those disparities in treatment. And we gave 2 clinical science fellowship grants, one to Dr. Kunmi Sobowale. This is so interesting. He's looking at the impact of maternal postpartum depression on infants' mental health and tracking that as the child grows up. Dr. Carolyn Kraus is looking at how and why we measure functioning in addition to symptom reduction in evidence-based treatment. So for example, if your child is, or your teenager is getting treatment, they usually measure symptom reduction. But Dr. Krause is developing tools to measure improvements in functioning for youth during and after evidence-based treatments. So there have been protocols to measure adult functioning in therapy, but not for youth. So that's a cutting edge thing that AIM is jumping into. Also, Dr. Hannah Lawrence is looking at how smartphone delivered mindfulness prompts may reduce anxiety and depression in teens. So also in 2022, our next impact point is we listened. We listened to the youth. The AIM Ideas Lab was a huge success, and youth are already signing up and getting involved in Ideas Labs in Monterey County, Santa Cruz County, Marin County, and we're even going to launch one or a couple in LA County. And San Luis Obispo County, of course, if I mentioned that. So right now, 141 high school students, in 2022, sorry, 141 high school students have participated in the Ideas Lab, 91 teens from last year in Monterey and Alameda counties. 50 teens are currently participating, but we're still recruiting more to come. The youth collected data about youth mental health from hundreds of their peers, and they created a scientific journal style report. They presented their data at Care in the Crisis, the AIM Scientific Symposium. I want to take just a moment and see if I can click on this, and we can take a second and just look at what they did.
Out, see if this works.
The Ideas Lab.
Okay, it doesn't look like I'm going to be able to sound. Sorry about that, but you can click on that. It'll be.
Good afternoon. My name is
It'll be-
Citlali
here we go.
Nava, and I am a senior from North Salinas High School. I joined.
So let's close that down to this. Okay, so they also
There we go.
Okay. All right. Hopefully you can hear me. They also presented at the Future of Mental Health Care, which was a national conference of leaders in the field of mental health. There's a link there. I think this one just goes to the page of, I want to show you the speakers. That's amazing. So this is the conference. And then look at these speakers, amazing speakers. Just a world-renowned group of speakers. And there's me. I was honored to speak as well. And look at our youth, Marwa, Citlali, and Gia. They did such a great job. They did an amazing job. I was so proud. I can hardly contain myself when they give their data. There was standing room only. Everybody, you know how people usually at conferences are on their phones or on their computers? Well, these guys just filled the room and everybody was listening. And the questions, we had to cut off the questions because we had to end the conference and people had, and we had another speaker. So yeah, it was great. So we were very successful, and I expect even more success this year. We have been invited to submit this to a scientific journal, and I'll tell you more about that later. Okay, so super proud of these kids. The youth were highlighted both conferences, and they got the highest feedback of any of the participants, any of the speakers. Okay, so here we go. Come on, here we go. Okay, so we prepared. We prepared caring adults in youth mental health first aid. We have trained 423 teachers, parents, coaches, and staff from 63 youth serving organizations. Let's look at this. Hopefully it'll load. Look at these. Look at the organizations we trained in 2022. Please take a look at that. I think you'll be so proud. And each of these organizations is better prepared. Their staffs are better prepared to deal with youth mental health challenges and crises that arise. Doing some good work. Okay. And so each of these individuals, they're now certified in youth mental health first aid. And you know, that training, some of you've taken it, it develops skills. It's not a woo-woo kind of training. It's not a lot of holding hands and singing Kumbaya. It is evidence-based, it's skills-based, and it trains people to recognize and respond to youth mental health challenges and provide safety and security until the youth can access treatment. And sometimes that takes a while. And then I'm going to be speaking at the National Council for Mental Wellbeing's conference, and that's in May. And I'll be talking about, can mental health first aid change the world? I believe it can. Can you imagine if all adults were trained in youth mental health first aid, at least had some skills? What a difference it would make. Impact we created. The AIM Design Challenge was another huge success with more than 300 middle and high school students who shared their artistic renditions. And these are just some of them. Right now, these are on display in the Monterey County Office of Education. And there'll be these pieces of art will be displayed all over and hopefully all over the state very soon. Okay, so we hosted the Care in the Crisis, the AIM Scientific Symposium, with the top speakers, the top researchers in youth mental health. They came to Carmel, and we had a day, we brought together these youth mental health experts, and among them was the youth themselves. So, and also a panel of parents talking about their struggles. This next year, we're planning a 2-day conference at the Monterey Conference Center, and we've already started to get speakers and a plan together, and I'll share a little bit more about that with you at the board meeting. So, so mark your calendar for April 20th and 21st. We're expanding it. We already have partnerships with the National Council for Mental Wellbeing, like I mentioned, and I'll be going and speaking at their conference after our conference. And then the Huntsman Institute for Mental Health is hosting a day full of just talking about stigma, about what it does for youth, talking about stigma. The youth will be involved in all of this, and youth will share stigma from their perspective. Okay, we empowered. The AIM, our Youth Advisory Board, presented Mind, Meditation, and Movement, a 1-day conference, and they have a whole schedule for this year planned, featuring expert speakers discussing the science behind the mind-body connection. And there was a particular, and I put a link here, so if you want to look at it, there's a particularly interesting panel about the topic of researching the mental health benefits of psychedelics. And we had some experts in the use of psychedelics in mental health. So, and then in preparation for the holidays, we hosted an eating disorders workshop. And we trained 30 body positive ambassadors with a scientifically based framework to support teens suffering from eating disorders, especially during the holidays. And did you know that of all youth mental health disorders, eating disorders had the largest spike during the COVID isolation? And we have some ideas about why that may be. And so we thought we really need to jump in and really look at the issue of eating disorders. And so we did. And thanks all of you for your support. Okay, and we united. This year has been a year of unification. Our walk and rally, more than 300 people walked in solidarity to break the silence and end the stigma around youth mental health and youth mental illness. We collaborated with 23 youth serving organizations, and they all came together to share mental health resources with the community, but also we shared dance, music, yoga, and a lot of hope. So, and I just want to add that we're collaborating on so many fronts. So I'm serving on the Strategic Expansion Committee for the Sticks and Stones project of Harmony at Home. I've been helping on serving on, it's not a board, but it's a committee. And then we're working with Ohana and the Community Foundation to form a youth mental health collaborative in Monterey County, and then we'll take that model to other counties. Next will be a collaborative in Santa Cruz County. We're actually talking with people in Santa Cruz County because that's kind of forming around some agencies that I'm very familiar with. And so we're hoping to bring together people to solve because you have to bring a lot of people together to solve complex problems. Okay, so I'm on the, this is funny. I'm on the advisory council of the Leadership Council of the Children's Health Council. So the Children's Health Council is affiliated with Stanford, and I'll share more about that with you if you'd like to hear about it. But we're helping create a map of the youth mental health services in Northern California so that parents, providers, educators, anyone can go on to the map and see who is providing what, where, and we'll sort it by treatments and things like that. And I'm leading that endeavor for the council. So Susan and I had the honor of being part of the Stop the Stigma Grand Challenge. And this is being led by Dr. Mark Rappaport, who is a member of our scientific advisory board. This Stop the Stigma Grand Challenge is national and it's enormous. They have the Ad Council involved. And as I mentioned about the second day of the AIM Symposium, the Stop the Stigma Grand Challenge is coming to talk about specific youth mental health stigma. So look forward to that. And also in 2022, we grew. So in San Luis Obispo, we're up and running thanks to the direction of Dr. Ramona Friedman. That's Dr. Friedman right there. And Dr. Friedman has pulled together a team of volunteers to bring AIM's Youth Mental Health First Aid and Ideas Lab to San Luis Obispo. And her team and psychology interns are providing training and support to parents. There's parents that are trying to navigate the youth mental health challenges of their adolescent children. As you may know, waiting lists are so long now, and Dr. Friedman has a private practice. She's an adolescent psychologist, and her waiting list is so long. We decided that let's have some evenings trainings for parents to talk about just navigating mental health for your adolescent children, and then at the scientific symposium, Dr. Friedman, and we're going to have another psychologist just there to answer questions from parents, just a office hours with the doctors, so that they can just find out what they need to know to sustain until they can find treatment for their kids. Pamela Clemens, you've met Pamela. She's recruiting and training an AIM Ideas Lab youth in in Marin County. And she's also been certified and she's starting to train herself in youth mental health first aid. And then Sydney Stillwell, Jenny Lang, and our AIM Youth Advisory Board are working hard in Los Angeles to prepare the mental health conferences, the series of speakers that I spoke about earlier. But also we're going to start launching some AIM Ideas Labs and things down there. Okay, so if you remember, at our strategy session in October, we set some goals. And so by Q4, we set some for Q4 2022. Let's look at them. So we proposed that the AIM and staff and board from the gala would net 400,000. That was our prediction, our goal. I think we did that really close. We grossed close to 600,000, and with our expenses and everything, we'll be probably above 400,000. We'll have those numbers for you by the board meeting. Okay, and then the 2022 year-end campaign, we wanted to raise a minimum of $180,000 through the year-end campaign. We did it. We exceeded it. We got $300,000 in the Monterey Gives campaign. We knocked it out of the park. We worked so hard, and I'm so grateful to all of this team. This team is incredible, and we can do such great things because of this hard work. We have a goal by April of this year, 2023, to have a minimum of 30 groups of 10 each high school students representing the 4 counties. And so they'll survey a minimum of 2,000 teens. They'll be analyzing the results. They'll be able to compare counties and a whole variety of speakers, and they'll present at our our conference, what they find, what the youth findings are. Mental health first aid by 2023, by December, but this year, we set a goal to train a minimum of 500 adults in youth mental health first aid. And concurrently, we want to develop the teen mental health first aid program. We've got to start raising money for that. That'll take a big lift to get that going. But I think we're going to exceed 500 adults this month in January. We already have 5 or 6 trainings scheduled. So we're doing great on that. Design challenge, we're going to do the same thing. We're going to expand it. And then clinical science and equity and implementation grants we'll be giving. And then we're looking forward to really training clinicians. And at the symposium, we're looking at doing a series of webinars, and we want to training parents and clinicians, because we so strongly believe that that is what our youth need. So with that, I will say thank you so much, and I will see you very, very soon. All right. Thanks again, everyone, for great year.